Okay, so today's skill, I'm going to be emptying a Foley catheter bag, and then I'm going to be discontinuing the Foley catheter itself. Okay, so the supplies I'm going to need is going to be first a 10 cc syringe, clean. I need a bucket or a measuring cup to measure the urine, as well as I need a towel to be able to fit between the patient's legs when I take out the catheter that is going to then catch any extra that comes out. Okay. So before I get started, I'm going to make sure that I have a order to actually remove the catheter before I even walk into the room. So let's say that I verified the order. Knock, knock, knock. Good morning. My name is Tyler. I'm going to be your nurse today. I'm just doing my hand hygiene. I'm washing my hands. I'm going to don my gloves. Could I get you to verify your name and date of birth for me? Perfect. Hector Ochoa, 1/1/1980. Perfect. Well, Mr. Ochoa, I have an order to go ahead and remove that Foley catheter of yours. Is that okay with you? Do you just to make you understand what that means? That I'm going to deflate the balloon that is inside the catheter. Once I deflate that balloon, I will be able to remove the tube entirely. Okay. After I remove the tube, we're going to make sure that we're paying attention to your urinary system, making sure that within 8 hours after removal of your Foley catheter that you do actually void or you actually urinate. Okay, does that sound all right with you? All right. So I've washed my hands, I've introduced myself, identified my patient, I'm providing for privacy. Okay, I've explained the procedure. Now I'm going to raise the bed to a working height. The key is with the Foley catheter bag, I want to make sure that I'm raising up so I'm not hurting my back. You can raise it up to the whole bed to a working height to better help measure and alleviate any back pain from you having to bend over. Okay, so I'm going to raise the bed entirely to a working height, making sure I have my side rails up, safety is ensured. Okay, so I'm going to come over here to the side of the catheter bag. Okay, so we'll see that I have my graduated cylinder right here to be able to measure the urine. Okay, so I'm just going to kneel down. I have my uh, towel just in case, but I'm looking at the tubing. I'm making sure that I'm getting all the urine I can into this bag. Why it's key to empty the bag before you remove the Foley catheters, because when you're removing the catheter and you're having to move the tubage and the bag, it's a lot easier, as well as being able to measure it accurately before you remove it. Okay, so the best thing to do is to have your graduated cylinder on the floor flat. Okay, I'm going to make sure I pull down this lever. What you have to watch out for sometimes is the other nurse or tech did not close it properly, so it could come flying out. So you always want to make sure that you have the graduated cylinder prepared. Okay, so I'm going to go ahead and unclamp, let the urine drain into the graduated cylinder. I'm making sure that I'm not raising the bag to create a splash effect. Okay, so making sure that I get all of the urine out of the bag. What I'm assessing for is I'm assessing for the color, I'm assessing for the clarity, I'm assessing for any odor, as well as I would take this into the restroom of the patient's room. I would set it on a flat surface and I would get my measurement. So let's say I set it down and I got 575 cc's of urine. To me, that's um, cloudy, dark yellow. Okay, so I would want to make sure that I take this back and chart it. Okay, so I would take this to the restroom, I would empty it. Let's pretend that I did that. Okay, all right. I set it to the side so I can empty it later. I want to make sure that I get this catheter out of the patient and not leave them up this high in the bed. So like I said earlier, the supplies that you're going to need to take out the catheter is going to be a lot more simpler than inserting the catheter. I just need my 10 cc syringe and I need a towel to catch it. Okay, so Mr. Ochoa, what I'm going to do is I'm going to go ahead and I'm going to place a towel just below where the catheter is inserted to make sure that when I take it out, it doesn't make a mess. Okay, okay. All right, I'm just going to pull back on your gown just a little bit, maintaining privacy. I have my curtains pulled. Okay, I'm just going to insert this between your legs, making sure that it catches any dribble effect when I do remove the catheter. Okay, so I have my tube And I have my 10 cc syringe. I want to take this out. Okay. This is my Foley catheter balloon hub. So I'm not going to take my syringe to the port where I would get a sterile specimen. I'm going to take it straight to this hub, which sometimes the hub can be orange, sometimes it can be green. It just depends on what products your facility buys. Okay. So I'm going to plug in my 10 cc syringe, and I'm not going to pull on the tube. I'm just pulling on my syringe. Sometimes the pressure built in there is just enough to let it go very easily. What you really need to pay attention to before you even go into the room is how much or how many cc's of sterile saline was inserted into the balloon when the Foley catheter was inserted. So if there was 10 cc's inserted, I want to make sure that I am removing 10 cc's before I pull the tube. Okay. So I took it and I pushed it up and I got pulling back until I feel resistance. Okay. And I got 10 cc's. Okay. So this would go in the trash. Okay. So I've removed, I want to make sure I always double check to make sure I got all the fluid out, because if you think about it, that balloon has been inflated for whoever knows how long for this patient. So it could be a lot larger in diameter than it was when we inserted it. So that might be a little painful when removing it from the patient. So we want to make sure that we get all the cc's of sterile saline out of that balloon. Okay. So Mr. Ochoa, I just want you to take a deep breath on 3, and I'm going to remove this catheter. 1, 2, 3. Take a deep breath. Pulling. You're just pulling it out slowly. Okay. Sometimes what happens is a dribble comes out. You want to make sure that if urine starts coming out of the tube, that you just wrap it right in this towel to help catch that. Okay. For educational purposes, I want to show you what the balloon looks like when you inflate it. So I have this attached. Let me get this. Okay. So what it actually looks like is when you insert the catheter and it goes into the bladder, that balloon, once inflated, puffs out like this. Okay, so that's 10 cc's of normal saline that's inserted into that balloon. This is what helps lock it in the bladder. So you want to especially make sure that you have drained the fluid from that balloon before you take out the catheter. Okay, it's also important to educate patients to not pull the tube, the Foley catheter out while it's inflated, because that can cause damage to their urethra. Okay. So I removed that. I'm going to put this in my biohazard bag right back here. Okay. Off my gloves. Do hand hygiene. I cleaned up the patient before I took off my gloves. I'll lower the bed. All right, Mr. Ochoa, just as a reminder, I want to make sure within the next 8 hours you do have a voiding episode, because we want to make sure that your urinary system is working without that catheter needing to be in place. So I'm going to make sure that I have your bed at the lowest position. I'm going to have your call light within reach, all your belongings within reach, making sure you do call us before you get out of bed to go to the restroom, okay? We'll be happy to assist you. And that's it.